Loss, Grief, and Mourning Module 1, Foundations of Loss and Grief. Loss is a universal human experience. As nurses, we care for patients and families at some of the most vulnerable moments of their lives. Understanding grief and mourning allows us to provide compassionate, evidence-based care. In this module, we will explore the foundations of loss and grief. Loss is not limited to death. It can occur across multiple domains of life. Physiologic losses include amputation or mastectomy. Safety losses include financial instability or job loss. Love and belonging losses include divorce or separation. Self-esteem and self-actualization losses may involve identity or role changes. Grief is the response to any meaningful loss. Grief is the internal, emotional response to loss. Mourning is the outward expression of grief shaped by culture and personal beliefs. Anticipatory grief occurs before an expected loss. Disenfranchised grief occurs when the loss is not socially recognized or supported. Understanding these distinctions helps nurses assess patient needs accurately. The grieving process often includes denial, anger, bargaining, depression, and acceptance. However, grief is not linear. Individuals may move back and forth between responses. The goal is not to eliminate grief, but to adapt to life after loss. Rather than stages, J. William Worden describes 4 tasks of mourning. First, accept the reality of the loss. Second, process the pain while caring for oneself. Third, adjust to life without the deceased. Fourth, develop an enduring connection with the deceased while moving forward. These tasks emphasize adaptation rather than completion. There is no predictable timeline for grief. Tears are not weakness. Grief and depression are not the same. And individuals do not simply get over loss. Healthy grieving involves moving toward the pain, not avoiding it. On the NCLEX, remember, grief is a normal response to loss. It becomes concerning when it persists beyond expected cultural norms, worsens over time, or significantly impairs functioning. Assessment is always the nurse's first step. In this module, we defined loss, grief, and mourning and explored the normal grieving process. In Module 2, we will focus on nursing assessment and interventions in grief care.